Welcome to this Guardian Elite Medical Services training module on transporting patients who are receiving intravenous antibiotics. On October 1st, 2025, the Southern Nevada Health District changed its scope of practice to allow AEMTs and Paramedics to transport patients who have had antibiotics initiated in a sending facility. The benefits of this change include faster response times to transport patients, decreased cost to the payer, and increased availability of critical care transport units. In this video, we'll review commonly encountered antibiotics, clinical considerations, how to monitor infusions, and how to safely transition from an IV pump to a dial flow device. Most importantly, we'll review our new protocol update that guides how these transports should be conducted. Intravenous antibiotics are frequently started in the hospital emergency departments, clinics, and inpatient facilities prior to interfacility transfer. Your role as a transport team is to monitor the patient, ensure the infusion is running correctly, and document appropriately. You may encounter a variety of antibiotics during transport. Here are some common examples. Ceftriaxone or Zosyn is usually 1 to 2 grams in 50 to 100 milliliters normal saline or D5W, infused over 30 minutes, and commonly given for pneumonia, sepsis, or UTIs. Vancomycin is typically 1 gram in 250 milliliters normal saline, infused over 60 to 120 minutes, and used for MRSA or skin infections. We do want to make sure that we monitor patients on vancomycin closely for red band syndrome if it's administered too fast. Zosyn is usually 3.375 grams in 100 milliliters normal saline, infused over 30 to 60 minutes, and given for abdominal infections and pneumonia. Levofloxacin is typically 50 to 750 milligrams in 100 milliliters D5W, given over 60 minutes, and given for bronchitis, pneumonia, and UTIs. Ertapenem, or Ivans, is usually 1 gram over 100 milliliters normal saline, given over 30 minutes, and used for skin or intra-abdominal infections. When giving antibiotics, we want to be alert for side effects during the infusion, including nausea or vomiting, diarrhea, rash or flushing, shortness of breath, swelling of the face or lips, changes in level of consciousness, or a drop or spike in blood pressure. If you observe any of these during transport, you may be dealing with allergic reaction or intolerance. Effective immediately, all EMTs and paramedics transporting patients on IV antibiotics must follow this protocol. Obtain and document the name of the antibiotic. Obtain and document the dose and rate of administration. If unfamiliar with the antibiotic, ask the sending facility about any specific side effects. Monitor the medication to ensure proper administration rate during transport. Monitor the patient for signs of side effects or allergic reactions, including nausea or vomiting, diarrhea, rash, swelling or hives, shortness of breath, or changes in blood pressure or level of consciousness. If any of the signs of intolerance or an allergic reaction occur, discontinue the IV immediately. Initiate appropriate treatment per protocol. Document the event and your actions. And lastly, inform the receiving facility staff upon arrival. This protocol allows us to maintain high standards of care and minimizes risks of complications during transport. Let's now look at how to handle the antibiotic infusion itself, especially when transferring from an IV pump to a dial flow device. If a sending facility started the IV antibiotic using a hospital IV pump and you need to switch to a dial flow device for transport, follow these steps. Verify the prescribed rate and total volume. Clamp the IV line and disconnect the pump tubing. Confirm IV patency by flushing the line. Spike the IV bag with a new dial flow set and prime the tubing. Use the conversion chart to set the correct mLs per hour on the dial flow. Attach to the patient, unclamp, and verify flow is occurring. And label the tubing with the medication, rate, and time of start. Before departing the facility, make sure to confirm the antibiotic name, dose, volume, and rate. Note the start time and expected end time. Assess the IV site for patency and infiltration, and check for patient allergies and current condition. Transporting patients on IV antibiotics is a routine, low-risk process as long as you're paying attention to the medication, the rate, and the patient. This protocol ensures that we're prepared, compliant, and patient-focused. If you ever feel unsure during transport, please don't hesitate to reach out to your supervisor or request online medical control.